So I'm gonna do a couple follow-up videos just for the Facebook group members. Sun's just coming up. It's 38 degrees, and it's a little too chilly for me to be out just yet. So I have a cup of coffee, and I've been running analysis on um, the difference between infrared and traditional Finnish sauna research studies, just to find some of the differences. And it just so happens that just yesterday, a group member, Steven, requested that we talk about this. So I've been doing it already. I'm not finished with it. So I'll make a few follow up videos that are like formal and everything else. But this is just to get our feet wet. I want to read you. I'll put this on YouTube. I've got YouTube screen over here. I've got the Facebook group. I have my notes if we need them. And then I'll just run through the pros and cons, or the findings rather, of each style. There are some differences. A lot of times people are really hell bent on thinking that the temperature of the actual sauna session is what dictates whether you get benefit or not. But what I see, I'm going to show you the findings so that you can come to your own conclusion. But what I see being the common denominator is not the temperature of the sauna, it's the duration that you're staying in there and the temperature that you're using it at combined to give you a core temperature increase and how long that sustains. So from where I sit, what I see, let's see if you think the same after in the YouTube description, I will put all the links to the studies that are used in this analysis so that in the synopsis, you can see which study, we got each, piece of information from. But what I think is the key common denominator is not the actual temperature of the cabin, but the one thing that's left out that really needs to be a consistent metric from every single one of these studies is kind of like Dr. Ashley Mason did with the whole body hyperthermia. These patients need to either be wearing a rectal thermometer or they need to have some type of measurement device on their body so that you can see what's happening inside their body during that duration of time, because that's really what is providing these benefits of heat therapy. It's not that some of them are in cabins that are 212 degrees and some of them are in cabins that are 140 degrees, because you're not getting a picture of internally that set of stimuli or response, like the response rate of the body itself. And this is going to differ from person to person. That's why you need to see it and it needs to be charted out. So if there was one thing that right off the bat that I could say, it doesn't render the results of these studies useless, but there are some key things that are really missing that would allow us to come to better conclusions and design protocols and pick, specific equipment to give us the best benefit for our needs given our situation if we had that data. So let's begin. We're going to talk about Waon therapy from Japan today, which is specifically infrared sauna therapy. And we're going to talk about Finnish sauna bathing from Eastern Finland, which is specifically traditional sauna. So number one, some data suggests from the JAMA network, and these links are in the description, and I'll just continue to remind you if you want to check them out yourself. I encourage you to do that because I want to hear from you in the comments. What do you think? What other data sets do you think are missing? Because there are a couple other things that would be useful for this. But Waon therapy in their clinical protocol is far infrared dry sauna at 140 degrees for 15 minutes, and then 30 minutes of warm rest wrapped in blankets. This is usually repeated frequently in cardiac patients under medical supervision. And I don't know if you've heard about this before, but one of the cancer protocols from Europe does require, it basically mimics, Dr. Ashley Mason's whole body hyperthermia treatments basically mimic that protocol. And there's a key thing in there where wrapping the patients in hot blankets to retain internal core temp, even though they've been removed from the heat source, is a key distinction. Because while they're not superheating the body for long durations of time, what they are doing is they're sustaining the drop in temperature. So they're keeping that core temperature high for a much longer period of time. Now, I don't think all Waon therapy is taking it to that degree, especially not from these studies, from what I can tell, but it is something to be aware of. Now, compare that to Finnish sauna as like a cultural habit, societal, community practice. I don't think anybody talks about that part either. which is the community aspect. We all get together. I don't care if you're drinking vodka and you're in the sauna or whatever, but we're all getting together, and this is like a social thing where we do it together. And there's something to be said about stress relief from that aspect alone that I think should be talked about, because I think it's very important. Also, whole body hyperthermia therapy or Waon therapy with a medical, supervised sessions, you're not alone. You have somebody that's guiding you through this thing. So if you get too hot, if you have, issues or this, that, and the other, there's some sort of social aspect to these, which I think is largely not even thought about from people who dissect this data. But Finnish sauna in habitual practice is traditional hot air convection sauna, which is typically 80 to 100 degrees Celsius, which is 162 to 212 Fahrenheit. Short stints, right? 1 to 3 rounds of 10 to 20 minutes typically, based on this study. That's not how people that I know use this, but in these studies, it's often like a lifelong habit in the community. And so the research largely follows general population cohorts in Eastern Finland. And so study designs for Waon therapy, which are a little different, they are interventional clinical studies in patients with chronic heart failure and hypertension, plus mechanistic work on autonomic and endothelial function. Outcomes include cardiac biomarkers, functional capacity, hemodynamics, and event rates. So they're measuring key specific things with patients with heart trouble, and they're getting great results. So that's something to really dive into and pay attention to. Finnish sauna, prospective cohort studies tracking middle-aged results for decades. Outcomes include sudden cardiac death, CHD, CVD, all-cause mortality, and incident hypertension. Some acute interventional physiological studies, FMD, heat acclimation, exist, but the flagship evidence is epidemiology. So the big thing there is reduction in all-cause mortality, but whereas Waon therapy isn't really like, I don't interpret these results as Waon therapy being a lifestyle, whereas I do interpret the results of Finnish sauna being a lifestyle. So that's two different types of data from the studies. Who's to say if you incorporated both as a lifestyle? It's pretty clear to me that there would be benefits. Is there differentiation in benefits? I'm not exactly sure. But what I gather from all of this is that be doing some form of heat therapy. Be doing heat therapy, whatever that looks like. If it's hot bath, if it's jacuzzi, if it's infrared sauna, if it's traditional sauna, it doesn't really matter. The body thrives on some forms of heat therapy. That's what I pull out from, rather than arguing about is one better than the other, because these data sets are a little bit different. Excuse me, getting raspy. Let's talk about key cardiovascular outcomes. In Waon therapy, patients with heart disease, improved cardiac function, reduced BNP, and better 6-minute walk distance improved overall quality of life. That's in the first PubMed study. The second PubMed study has lower cardiac events and mortality in CHF over the course of 5 years, which is a 50% lower rate of cardiac deaths or events versus the controls. That's nothing to sneeze at, That's a relatively gentle therapy, in my opinion, except for the blanket part. I don't do the blanket part, but I do everything else. Blood pressure reduction after 1 week of daily sessions in hypertensive patients. The effects are especially notable in non-smokers. My own life experience, especially post-leukemia treatment for me personally, that was evident from day one. I've kind of screamed from the rooftops. I don't like to say too much because we don't position sauna as like some medical treatment device or this, that, and the other. But it's basically like body maintenance for the long term. I mean, I was going to the hospital 5 days a week, getting arsenic infusion treatments and taking drugs that are known to increase blood pressure, right? They pretty much put everyone on high blood pressure medication. But I was able to keep my blood pressure under a threshold and also keep my stress and anxiety down from going to this. This was a lifestyle. Like I literally go to the hospital 5 days a week. Right. And they won't treat you, like I say in other videos, they won't treat you until you have vitals from all the nurses. You're getting weekly EKGs. You're getting blood labs twice a week on the daily in real time. So I noticed that just from walking, I think if you're able to, I think you should include walking with your heat therapy because, and this is something for me, this is just a personal opinion. It's not in any of the studies. There's no scientific data that I see out there to support this, but you're doing a couple things, and I call it priming, right? You're priming your body for this heat therapy session. It doesn't matter if you're in a traditional sauna, an infrared sauna, if you're doing jacuzzi, it doesn't matter. The benefits of walking are documented on their own. And so when you're able to prime the body pre-heat or pre-sauna session, heat therapy session, you're able to get movement that's also going to ramp up lymphatic fluid exchange, which is going to happen anyway with your vasodilation and increased circulation when you start your heat therapy, right? But rather than just sitting there and waiting for your body to slowly heat up, if you can do some type of brisk exercise to prime or to preheat the body rather, and get all the other benefits associated with the movement, it's kind of like the people that left out the part of what yoga was for, right? If you wanted to sit in meditation for a very long time and you know that you were going to need to be still, wouldn't it be beneficial if you were, stretched out, removed all tension from your muscles, ligaments, all this stuff? This is kind of very similar. You know that you're going to be sitting in this hot box, regardless of what type it is. Why wouldn't you go and walk and do a few things that have other benefits, but also prime the body for this time period? That's my take on it. I'd highly recommend that you incorporate that. In my own personal life, I saw benefit from just walking and sauna sessions, not even every single day, every other day. Kept my blood pressure in check while I was, doing all this hospital stuff. So let's talk about Waon therapy again, because the blood pressure section is, pretty easy for you to see. Autonomic and endothelial benefits: improved parasympathetic tone, decreased sympathetic activity, mobilization of endothelial progenitor, CD34 plus cells. That part's beyond me, but I experience this swap, and I talk about this between sympathetic, parasympathetic. I think this is why a lot of people just say that they, like if you ask people what their specific health benefits are from using infrared sauna, and this is from the Waon therapy studies, they'll just say, oh, well, I just feel better when I do it, right? Well, that could mean a lot of different things. But largely, if you're able to just decrease stress, what's going to improve? Your sleep, your well-being, your state of mind, your cognition, right? You're basically like, offloading some of that ongoing, consistent, stressors and everything. You're going to get an uptick downstream in everything from that when that takes place. Conversely, compared to Finnish sauna, which is on the general population, and it doesn't say, whether these people are health challenged. And I'd like to point that out because Waon therapy infrared is specifically dealing with people who are health challenged. I should have done a medical disclaimer. I'm not a doctor. None of this is medical advice. If you're looking for that, please see a licensed medical physician. Finnish sauna dose response association: more frequent sauna use, 4 to 7 times a week. So social. Correlates with lower SCD, CHD, CVD, and all-cause mortality versus 1 time a week. Observational, not a treatment trial. They do note that from the JAMA network. Study link is in the description if you want to take a look and see what you think. Risk prediction improves when sauna habits are added to standard CVD risk models, men and women. Acute physiology: single sessions can transiently improve brachial artery FMD and reactive hyperemia. Longer supervised 8-week programs in stable CAD showed heat accumulation, but no significant FMD improvement. Mechanistic nuisance. So you have to think about that and take that into account as well. Synergy with fitness: high frequency sauna plus good cardiorespiratory fitness associates the lowest SCD risk with the cohort data. Kind of the same thing that we're talking about with just walking in sauna. This is a lot more high intensity. It's high heat and everything else. But the data set is different based on the population that are participating in the study. So take from that what you will. Now, where there is some overlap here, both lines of evidence have overlapping mechanisms. You got vasodilation and hemodynamic unloading. I don't talk about the second one very often, but vasodilation is like number one. You get improved vascular function, lower afterload, preload, and just the body loves to be supported in this way. That's kind of how I describe it in all the other videos. Heat-induced hormesis. You're getting cellular stress responses, which are going to make heat shock proteins. autonomic rebalancing, and also an uptick in parasympathetic. That by itself has tons and tons of benefits, and you can get that even with a jacuzzi or a hot bath. So this argument that, like, one of the things that's left out of these comparisons is the actual temperature, and the temperature is what everyone is latching onto, which I think is a mistake, because there's no metric in here that's telling you what's happening inside these people's bodies. They're just putting them in a specified air temperature in a room. Well, that doesn't really tell you what you need to know in order to decipher or mimic or replicate or even extract like the most meaningful parts of this, so that you could have a protocol or a piece of equipment for yourself to do either the bare minimum and get the all-cause mortality, reduction, or if you are health challenged and you're looking to target something specific, you would need to know these things so that you could mimic them and achieve the same result. So, I think that's most people's gripe, is that there's not a lot of studies on a lot of these things. If you go look at red light therapy on PubMed, if you look at photobiomodulation, there are so many more methods to decipher, oh, it's this wavelength, it was this intensity, it's this amount of time. Like it's a piece of cake. If you have a TBI, or if your child, is suffering from X and there's a study on it, you can just go look at it, buy a piece of equipment that has the same wavelength, use it at the set treatment distance, and only do it for the specified amount of times that you would want to replicate from the study. It's like so much easier. Cardiovascular conditioning, passive cardio, modest heart rate elevation, improved circulation akin to light exercise. I talk about this a lot for the last 5 years. If you can't exercise and you're health challenged, I think one of the biggest benefits is that you're increasing your heart rate without moving, right? So if you have some type of injury, if you are, whatever the whatever the situational limitation is, you can still get the benefit just by incorporating this into your life. I think that's very powerful for most people, whether you're an athlete or whether you're disabled. It doesn't really matter, right? So for people with diagnosed heart disease, especially CHF, use the structured low temperature Waon protocol, which is 60 degrees Celsius or 150 degrees Fahrenheit, 15 minutes plus the 30-minute warm rest. Ideally under clinician guidance if you're actually having, some type of heart trouble. But the clinical studies show the improved cardiac function, BP, autonomic balance, and fewer cardiac events just by doing this. So it's interesting to see in the United States where some cardiologists will say, you have a heart condition, you shouldn't do sauna therapy anymore. But is there a distinction there between, you shouldn't do Finnish sauna at 212 degrees anymore, or you shouldn't do any heat therapy, and why? So I think the other thing we need to do is get a little better grasp on some of this data and ask better questions when we go and see these doctors for ourselves. For the general public focused on longevity and prevention, the Finnish data suggests that clear dose response, 4 to 7 sessions a week, associates with large relative risk reductions in all-cause mortality, CVD, CHD, SCD. Emphasize consistency and standard precautions, hydration, time, temperature tolerances. That's pretty much all from the JAMA network and the PubMed studies, also linked below. You can check those out. Why the results, look different. This is what I think we should really talk about. I kind of already touched on it. I jumped the gun, but the design. Waon is interventional clinical therapy in sick patients. Finnish is observational lifestyle data in community cohorts. Interventions can report casual changes in cardiac metrics and events within months to years, but cohorts show associations over decades. Also, the usage difference. Heat dose and control. Waon is standardized. There's an exact time, temp, warm up, rest. My opinion is largely that's because they're targeting specific folks with heart trouble. If they weren't, who's to say, you couldn't do multiple rounds or not do the blanket and just do a 45-minute session or something like that. But you also probably don't want to tax their system too hard and then wait for their heat tolerance to increase. It's kind of like training in the gym. You don't just go out and, become a power lifter. It takes years to develop that in the body. Whereas Finnish uses, it varies from temperature, rounds, timing. Standardization likely contributes to consistent clinical effects in frailer patients. And the endpoints are Waon focuses on clinical mechanism endpoints, or mechanistic, I should say. BNP, LVEF, autonomic incidence, event rates, finished cohorts center on long-term mortality and incident disease. So two totally different things, but you can tell, like the bottom line is if you need medically guided therapeutic protocol for heart disease, obviously something like Waon therapy has interventional, evidence for improved function and outcomes in CHF and BP control. If your goal is longevity and prevention in the general population, the Finnish sauna habit shows strong dose-dependent associations with lower CVD and all-cause mortality. Consistency of 4 to 7 times a week, though, supposedly matters according to this. Now, what do we take away from that? I already told you, midway through what I take away from it. But it's that the overlap here is the rise in core temperature, the vasodilation, the nervous system benefits that you're going to get from heat therapy, and whether or not you want to do high heat short sessions, multiple rounds, or you want to do something that's a little less intense. I don't know as if it really is going to matter that much. I think you're going to get the all-cause mortality. It's difficult because the intention of each study was going after a different result, and the data set and the participants, right, are in drastically different health condition. So if you normalize those and you told us what the core temperature metrics were throughout every single session and whether those changed as the folks, because as somebody's heat tolerance improves, you're not going to get the exact same core temp measurements, even if they're doing the same frequency, the same duration, the same blah, 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 blah. I notice this in myself, especially if I take a couple of months off from sauna therapy and then I go back to it. It's kind of like if you stop working out in the gym, you're only going to maintain your strength for so long. You're only going to maintain your cardiac ability for so long. Like you're going to lose your cardio. And so for me, heat therapy is much the same. It's a little bit more forgiving, but I notice when I go back to it that, it doesn't, I don't maintain forever, basically. So that's a pretty good synopsis to start. I'm going to go into some deeper points of each individual study in the subsequent videos. Just wanted to throw this together. I'll put it in the group for you and get us talking about it because I think this is really valuable. It's going to help, a lot of people. I don't mean the actual studies. I mean just, us communicating about this and dissecting and talking about these studies. I pull them up here and then basically, we chop it up. You can kind of see how if you just did the bare minimum with heat therapy, your longevity is going to improve. How could it not, right? You're going to see that even if you don't mimic the study participants exactly, you're going to get some of the benefits by incorporating this into your lifestyle. And so just reinforcing that all the time is very helpful for all of us because I'm no different. I do this all the time, but I fall off too. I'm human. I get off my weekly schedule. I travel or I'm back and forth. Right now I'm in the mountains. It's 38 degrees. The last thing that I want to do is go out and do my workout this morning. So I'm sandbagging a little bit. I'm making this video with you rather than, doing that because I don't want to shiver to death. So until next time, see you in the next one. Let me know what questions you have. And also please comment below. Take a look at these resources and the links. Look at the studies and tell me what you think. Do you agree? Do you disagree? I think it's constructive. We have a discussion about it either way. And what takeaways do you get from the studies? Do you think there's more overlap than I'm suggesting? Do you think there's less? What's your opinion? Have you tried both? Right? So we'll see you in the next portion of this.